October is Breast Cancer Awareness Month, so I'm urging everyone to remind everyone to go and get screened, or tell the women in your lives to go and get screened. We are big fans of breast cancer screening, although we as a company are applying AI software to improve breast cancer screening. We're a big fan of what's out there at the moment. It does save lives, so go and get screened, everyone that's out there. So just to remind you a little bit about who we are, we're a software company based in Wellington with software as a service. We apply AI to mammograms to help radiologists and other people generate high quality, safe images at very comfortable exams for the women to improve cancer detection rates and so on. Over the last 6 months, we raised 55 million. We brought a Seattle-based company called MRS, who do patient tracking software. We did that as part of a big data play, but I'm going to talk a little bit about that in a minute. Critical, though, I think, for everyone's understanding is the integration with MRS has gone extremely well. Mark Morris, the CEO there, has continued to be extremely professional, very easy to work with. He's now Executive Vice President of Volpara, and the whole team's meshing together excellently, so it's good. Q2 then is usually our quarter. Q1 is usually Q2 quarter, and Q3, Q4 build up as we head towards our big trade show, RSNA in Chicago, which is the big trade show, 55,000 people, and I think you'll be in awe at the whole size of it. That's the big trade show for us, Mac7, Promedicus, and other ASX listed companies in our space. Q2 then, we had excellent cash receipts, 4.9 million from customers. That was a mixture then of strong Volpara and MRS growth. In terms of that, we have over 40 million in the bank. We had a burn of just over 4 million. That's slightly over what we expected for the quarter due to some payroll timing issues. So we're very comfortable where we are, and everything's on budget and on track. So that's all excellent news. Annual recurring revenue is now $15.7 million. That's gone up $1 million over the quarter from 14.6. In March, our year is end March. In March this year, we forecast $17.1 million of ARR. We are well on track for that target. Some of the highlights of the deals, we've got another hospital in Adelaide. So almost every single hospital now in Adelaide uses our software. Several more big US sites and some prestigious sites like University of Miami came over the line as well. We're at 25.8% now of the US screening population now gets analysed by at least one Volpara product. So again, we're well on track for the 27% we forecast earlier this year. Just a few more points then. 1st of November, we start, obviously the integration with MRS has gone well. 4 weeks ago, we had a big meeting in Denver. All the sales and marketing team came together. We've now agreed on a software as a service pricing model for the MRS software and the Volpara software. That goes live 1st of November. So next week, that all goes live. All our salespeople now have the ability to quote the old MRS products, the old Volpara products. They can bundle it all together and so on. So that's quite a big moment for us. People ask about the cross-selling opportunities. There's a huge amount of activity around that. I think we've said previously how we've been amazed how many of our Volpara customers have been asking us about MRS, and we've been bringing MRS into deals. There's a lot of those deals now out there under the new SaaS pricing. It's not going to happen overnight. Again, our time frame is usually 6 to 9 months from contact to PO. So Q4, Q1 time will be when those deals start closing. We start to receive benefits of the cross-selling. We are coming up to RSNA, as we talked about. We're looking forward to that intensely. We are going to be showing better integrated products there. So we're doing a lot of engineering work where some of the MRS software is sending, for example, did this woman get cancer to the Volpara software? And then we're using that to improve our software. 2 other points I'm going to touch on. The FDA, we're still waiting for the FDA to come out on its reporting of breast density recommendations. They closed in June their comment period for that, so now we're just waiting for them to come out and say, all women must be told the breast density from this date and in this format. We're not sure what that format is or the date, but we've got a very strong sense it's coming. And the other one I just want to touch on is the huge randomised controlled trial in the Netherlands, 10 years in the making. This is Professor Carla Van Gils, called Project Dense. We now understand it's been accepted by a very major journal, and so that is imminent now. We've been talking about it for some time. It's been in the review process. It's now accepted. We don't know yet when it's coming out, but we do know it's coming out, and it is probably one of the top medical journals in the world. That's going to show using Volpara density to select high-risk women, and then doing breast MRI really does catch many more nasty cancers for that set of women.